director here at Community Fight Against GBV and HIV/AIDS CFAGS. CFAGS is a grassroots organization whose social mandate is to support survivors of sexual violence and their families to access post-rape care services. In July this year, 2022, we received support from Egmont Trust UK to implement a project called Tuungane Tulinde Watoto. Tuungane Tulinde Watoto in English means let's come together and protect children. So the goal of this particular project is to strengthen community systems to support vulnerable children against sexual violence and HIV/AIDS. In this particular project, we are working with the Ministry of Education to reach 10 public primary schools in Obunga and Manyata slums. And in this first phase of the project, we have conducted several activities. Indeed, just to mention, we have a goal of reaching 3,000 teenage girls. And we started implementing the project in July this year. And so far, we have indeed registered 3,000 girls. We have installed talking boxes. And those talking boxes are supposed to help children who go through abuse, various forms of abuse, to talk about these issues.
I'm Jenga Griffins. I work for CFAG as a community coordinator. I link the project activities to the community. Such activities include pinning the talking boxes on the walls in schools in question. I also ensure that the information that are within the box, we collect them in the absence with the teacher in charge of health in that particular school.
My name is Priscilla Wangare. I'm a community health volunteer linked to the child program. We do sensitization of defilement, rape, and also any other form of sexual violence to the children, especially girls. And we also go to schools. In particularly, we also go to a school like Ezra Gumbe Primary School, where we have a talking box for the children to be able to air their views and their challenges that they face, either both at home or in the community, in a confidentiality manner.
We try to build confidentiality to make it easy for them so that at least they can share the most traumatizing situation and events that they face. We understand that they can meet perpetrators anywhere, both in schools, at home, on their ways to schools, and that sometimes it becomes a challenge. So our responsibility in this institution is to make sure that we sensitize and we bring to their knowledge, because we understand that some of them don't even understand that they are being abused.
So the talking box, a child writes her own or his own, because we've left it open also for boys, so they can write their challenges that they face or a situation where they want to be helped with.
And we also encourage one-on-one talk. We also use these same girls to reach other girls, so they be voice for other girls.
In fact, initially we were to reach 10 primary schools, but due to community demand, there's a school called Wandiege, which is also a public primary school in Manyata, which was added. So we are talking about 11 primary schools. In those particular schools, each school has a talking box installed.
Our main data collection tools are Kobo Collect and Survey CTO. In Kobo Collect, we collect data of the 11 public primary schools that we are working with from Obunga and Manyata slums. In Survey CTO, we collect community perception, where we gauge the perception of the community in relation with our program activities and adjust where possible.
We've seen a huge response from the student population talking about various forms of abuse, and we've addressed each case accordingly. And we have social workers who collect these views every week, and they are brought to the office for analysis.
Right now, I'm at Exagumbe Primary School, a school that is one of the 10 schools that is covered within the program. I've come to collect the views from the pupils from the talking box before they are analyzed within the office. In the project of To the Child program, I'm there as the access to justice, case management. We have the talking boxes that have been placed in schools, and once we've received the cases from the school and they are being brought by the social workers, we identify them and we do some follow-ups.
And then those children are reached.
So from there we pick the case as the access to justice officer. Then we move with the child that has the case.
So there are cases of sexual abuse, there are cases of neglect, there are cases of child labor, there are cases of violence. So all those ones, we have social workers who collect those children are supported through counseling. If there are cases that need to be reported to the police, we do so. If there are cases that are supposed to be reported to the local administrators, like the area chiefs, we do so. If there are cases that needs the attention of the children officer, we do so.
I'm Velma Ndege. I work in CFAG as case manager. I ensure that once the survivor has been rescued, I escort her to the hospital for further medical checkup and later proceed to the police station where the survivor will record the statement and the police officer will give us the P3 form and proceed back to the hospital for the P3 form to be filled and later escort the survivor to the safe shelter,
where he's going to get counseling and other therapy that is required for this child.
We have a staff of around 12 young people who are supporting the project, but we also have community health volunteers. We have 11 of them. So each school has a community volunteer, and the community volunteer is acting like a bridge between the project and the community.
I'm Violet Atieno. I'm the office administrator at CFAX, and I also receive calls through the CFAX toll-free line from the community at large. In any case, I receive a case that needs attention, I inform the people in charge.
So what happens is that whenever a case in a particular area is brought to our attention through the toll-free line, a CHV is called, because those CHVs come from local areas. So once we did the mapping, and once a case is reported in a particular area, that CHV is rich with that information, and we are able to go and visit that particular case and take appropriate action.
So our aim is to protect girls, and we are saying no to GBV.
We also managed to buy or construct additional beds, and we are indeed very grateful to Egmont Trust, because so far we were able to construct 4 metallic beds, which are triple decker, and this has really improved our capacity to actually rescue more girls, and as we speak we have over 20 girls here in our rescue, and now we have sufficient space where these girls can stay. We were also able to lease 4 acres of land for 1 year, and on that land we planted corn or maize, beans. We've also planted tomatoes and kales. Kales is called sukuma wiki in Kenya. So we've started well, and from the look of things, it is still early days, but things are looking up, and we are very positive.
Our farm is around 5 to 6 kilometers away from this office. We are lucky enough to have this farm near the river, where we are not necessarily depend on the rainwater. We can sometimes do the pumping, and as I speak, our crops are doing so well.
That the set objectives are going to be achieved, that by December we expect this particular rescue center to be self-sufficient in terms of food.
We are near the permanent river where we always obtain the water during the artificial application because we don't always rely on the rainwater. Where we are is a nursery section where seedlings are managed before they are transplanted to the seedbed.
Right now, we are at the project farm. This place is called Agulu Village. Agulu Village is on Kisumu Bond Road, around 5 kilometers from the office. And as you can see, this is a corn farm. This maize, these are maize plants or corn, and they are 6 weeks old. And we've hired 4 acres. When you look at the entire area, we've hired 4 acres. As of now, we've done 1 acre with the corn. We hired the farm for 1 year, and 1 acre is planted with corn. We also have horticultural crops. We have kales, or we call them here sukuma wiki. We also have tomatoes. We also have onions and cabbages. We even have coriander there. So there are areas of the farm that have not been planted, but we prepared them. We've cleared the farm, tilling has been done, and 1 area has been planted with corn. The rest, we've divided the farm into different sections. We even have places there where we want to plant sweet potatoes. So we've hired farm from 4 individuals, but the farm is next to a permanent river. So we use that river to pump water. We do irrigation because we are not relying on the rainfall. And as you can see, our farm, the corn we have here is called Savo 4141, this hybrid. If you compare it to the neighboring farms, the farms belonging to the villagers around here, our farm is far much ahead of them. The maize plants are doing very well. And we've done intercropping. We have beans. Beans are also grade and hybrid. We have hybrid beans, and we also have hybrid maize seeds, and they are doing very well. And from the look of things, we'll have a good harvest. And so we are indeed very grateful to Egmont Trust at this juncture, because that support has seen CFAGS conduct a project that is so dear to every one of us, because we operate within the space of child protection. In this first phase, we focused more on building the capacity of the safe house, because we expect to get a lot of cases. So we really wanted to focus on the farm and building the capacity of the safe house, indeed within the budget. And in the second phase, we are going to now engage local actors. We are going to train local investigation officers, children officers, and healthcare providers. So we really look forward to engaging them. And from the look of things, this project is going to surpass the set objectives. And we are very delighted to be part of this particular project. Thank you.